Hello everyone, my name is TJ Scarpelli. We are coming at you today from the city of Roanoke, Virginia for today's episode of Broadening the Horizon on December 2nd, 2022. In today's episode, we are going to talk about epilepsy and the effects that exercise can have on persons with epilepsy. So, I have a little bit of experience with epilepsy myself. My first time witnessing an epileptic seizure was while I was coaching my swim team. Another team's coach got in the pool to demonstrate to students how to properly do something, and he actually ended up having a seizure in the deep end of the pool. Now, the reason that I bring this up is because exercising with epilepsy has a negative stigma attached to it. And the reality of the situation is that exercise is actually very beneficial for people with epilepsy. Fortunately, we have two experts with us today, Dr. Cooper Neville and Dr. Bryson Miller, and they are both here to help me tackle this subject and help shed light on just how beneficial exercise can be. All right, so to get us started, what exactly is epilepsy?
Well, epilepsy, of course, is defined as an enduring predisposition of the brain to generate epileptic seizures with cognitive, neurological, psychological, and social effects. These seizures arise from either the increased excitation of electrical communication between neurons or decreased electrical inhibition. This communication between the neurons is disrupted with an abnormal flow of electrical current, and this can cause damage to the neuron that is being communicated to, which can lead to physical damage. This happens when there is an abnormality between motor neurons, and post-seizure, there is often damage to or complete loss of motor function within the patient.
Thank you for that, Bryson. Now, Cooper, as an exercise physiologist who works closely with individuals with epilepsy, could you tell me how common epilepsy is? As I understand it, there's actually far more people that have epilepsy than some may realize.
Yeah, it is fairly common. According to the Journal of General Medicine, 1 in 26 Americans suffer from epilepsy. That's roughly 4% of all U.S. citizens. Certain factors like increased age, poor general health, sleep disorders, severe head trauma, and genetic predisposition have been considered to increase the risk of developing epilepsy.
Wow. So if I did my math right, which is admittedly questionable, that would make more than 13 million people in the U.S. alone that suffer from epilepsy. That's pretty crazy. So Cooper, you also mentioned before starting the show that you were currently conducting some research. What current literature is there that supports the claim that exercise is beneficial for epilepsy patients, and do you plan on conducting further research?
Yeah, at some point I do plan to continue to do research in the application of exercise for the epileptic population. As for current literature, a recent study by Eom et al. Aimed to outline the effect that an exercise therapy intervention had on the physical and psychological health of children. Other studies have supported the claim that exercise is actually beneficial for individuals with epilepsy, contrary to the previous thought within medicine that exercise exacerbates seizures. So it was found that certain metrics for neurocognitive function, psychomotor speed, sequential processing, and inhibition-disinhibition increased for the child participants due to exercise, in addition with improvements in emotional and psychosocial scores compared to a control group.
Very interesting. What exactly is it that you do with your patients?
So, with my experience with patients with epilepsy, there are definitely plenty of considerations to maintain when planning out an exercise plan, but also a lot of creative adaptations as well. As Pimentel et al. From 2014 suggests, main concerns with physical exercise participation for epilepsy patients regards the induction of seizures and injuries associated to the seizures during exercise. An additional risk is the nature of the patient's disease. So it is important to document information about the patient's epilepsy, including their pertinent history of seizures, what type of seizures they have, if they take medication for epilepsy, and their history of exercise.
You just mentioned medications. What is the main treatment option for epilepsy? Is it primarily just a cocktail of medications?
Well, the Victoria State Department of Health states that the mainstay of treatment for epileptic seizures are anti-epileptic medications such as zonisamide. Oftentimes, doctors will prescribe several different medications that will play off of each other to get to the desired result.
And what are some of the side effects of these medications that are actually pertinent to exercising?
Well, some of the side effects are going to be fatigue and tiredness. You'll have some blurred vision. There have been problems with concentration as well as balance and coordination issues, low motivation and energy, and slower reaction times. These are just some of the side effects that come with some limitations to exercise.
Now, building off of that, Cooper, if you don't mind, how would you prescribe exercise to individuals that have epilepsy or to patients that are on anti-epileptics?
So I formulate exercise plans based on the information the patients give me. I typically try and have the individual get some form of aerobic exercise for 3 to 5 days out of the week for at least 30 minutes of light to moderate intensity. The modality is based on the settings that have, or preventing settings that have a lot of triggers for seizures, and based on the abilities and comfort of the individual. I also try to encourage some form of resistance training and flexibility for my patients if it is suitable. For patients that are taking anti-epileptic medications, we have to take into account the side effects you mentioned before. So engaging in exercise modalities to help to prevent or reduce these side effects like yoga, Pilates, or other balance-building, low-intensity types of exercise is crucial in the planning of these exercise plans.
That's interesting that you say that. And to support that, Dr. Vazani, an expert in neurodegenerative diseases, conducted an experiment in 2014. In this experiment, she mentions how inflammation is an important factor in neurodegenerative diseases, specifically epilepsy. With inflammation being a normal response to issues in the brain, exercise is vital in maintaining the fluctuation of inflammatory proteins that could lead to epileptic seizures. Knowing this, it is definitely important to address those specific exercise considerations.
I completely agree. Going off of what Dr. Miller said, ensuring the safety and well-being of individuals with epilepsy is a top priority when introducing or continuing exercise.
Do either of you have any other considerations to exercise for us?
Well, there was also another study done by Miller et al. Explaining how there is a level of cognitive impairment in older adults with epilepsy. It is important to note that in this study, risk factors were identified that led to an increase in cognitive impairment, two main risks being depression and or higher levels of anxiety. Knowing the risk factors can help with differential diagnosis and cognitive complaints, as well as help improve treatment designs for this population.
To go along with that, according to Alan Dorfer et al., several studies have yielded very promising results pointing towards the mitigation and possible reversal of cognitive damages done by epilepsy. One of these tests showed that simply swimming daily for 30 days had a significant effect on the learning and memory deficits. It is also known that epilepsy has long-term effects on potentiation in the brain. Another study took a look at the effects of exercise on long-term potentiation and shows that exercise had actually partially repaired hippocampal LTP.
All right, so we have definitely covered a lot of information today. We learned about the mechanics of epilepsy, including the characteristics of the disease and its prevalence within the United States.
Yeah, so as we said before, epilepsy is a common disorder that affects 1 in 26 Americans. And it is characterized by either an excitation or inhibition of the communication between neurons in the brain, which can lead to epileptic seizures. We also noted that inflammation can play a huge role in that excitation factor as well.
And Cooper, can you circle back and briefly highlight the main considerations and benefits of exercise for this population again?
Yeah, for sure. The pertinent history of the patient's disease, its severity, and symptoms are all important factors that go into exercise prescription. Exercise is important for individuals with epilepsy and its assistance with improving multiple cognitive and psychological factors. in mediating the symptoms of epilepsy by controlling seizure rates and also improving the overall health of the individual.
Well, that looks like all the time we have for today. I want to thank Dr. Bryson and Dr. Cooper for joining us on the show today.
Thank you.
Tune in next week for another episode of Broadening the Horizon for a special episode on multiple sclerosis. I'm your host, TJ Scarpelli, telling you to have a sunny Salem day.